Be honest, when someone says dental clinic, you immediately think of that chair, that light, and that mysterious tray of shiny tools, right? But what if I told you the scariest part of your appointment is not what you think it is? Today, we are revealing the truth about visiting a dental clinic, the things nobody explains before you sit down and open wide. And Dr. Esma is here with me, smiling suspiciously calm, which makes me even more curious. Dr. Esma, what are patients most surprised about the moment they walk through that door?
Rasim, most patients expect pain. What they actually experience is relief. The real surprise is how much control they have over timing, comfort, even the treatment plan itself. But here is the twist. Many people delay appointments for years because of assumptions that are simply outdated.
So you are saying the fear is louder than the reality. That is interesting, because what if avoiding the clinic is actually the bigger risk? I think a lot of people watching right now are thinking, that is me. They wait until the tooth hurts, until chewing on one side becomes a lifestyle choice, until they are Googling symptoms at midnight. Dr. Esma, why do we always wait for pain before booking that appointment?
Because pain feels urgent, Rasim. Prevention feels optional. Many patients tell me it did not hurt, so I thought it was fine. But dental problems are often silent at the beginning. Small cavities, early gum inflammation, tiny cracks. By the time it hurts, the treatment is usually more complex than it needed to be.
So that quick checkup people postpone for months could actually be the easiest visit of the year.
Exactly. What feels small today can grow quietly, and that is the part no one talks about.
Okay, but let us make this real. Give me a scenario. Someone skips cleanings for 2 years because everything feels fine. What actually happens behind the scenes?
Great question, Rasim. Plaque hardens into tartar, gums become inflamed, bone support can slowly decrease. The patient may only notice a little bleeding while brushing. But over time, that small sign can lead to gum disease, tooth mobility, even tooth loss. And here is the important part. Early treatment is simple and comfortable, while advanced treatment requires more time and recovery.
So we are not just talking about teeth. We are talking about long-term health decisions made in small daily moments.
Exactly. A simple visit today can protect your smile for years, and that is why it truly matters.
Dr. Esma, give us a real-world snapshot. How common is this delay cycle we are talking about?
Very common, Rasim. A large portion of adults skip regular checkups and only come in when discomfort starts. I recently saw a patient in his early 40s who had not visited a clinic in 5 years. He felt fine, just occasional bleeding while brushing. After a full examination and x-rays, we found moderate gum disease that had been progressing quietly. The good news, once we started treatment and proper follow-up, his gums improved significantly within months.
So it was not dramatic pain, it was silent progression.
Exactly. And that is why awareness matters more than fear.
Alright, Dr. Esma, let us zoom out for a second. From a scientific perspective, what is actually happening in the mouth when someone skips regular visits? Because I feel like there is a whole microscopic drama going on that we cannot see.
You are absolutely right, Rasim. The mouth hosts billions of bacteria. When oral hygiene and professional cleanings are inconsistent, harmful bacteria dominate. They release toxins that irritate the gums and trigger inflammation. Over time, this inflammatory response can affect not only the gums but also overall health. Research links advanced gum disease with heart conditions and metabolic disorders. So a dental visit is not just cosmetic, it is preventive medicine.
So that quick appointment is basically a science-backed health check for your entire body.
Exactly, Mr. Rasim. Prevention is powerful because biology never takes a day off.
Alright, Dr. Esma, let us make this practical. Someone watching right now is thinking, fine, I get it. What exactly should I do next? Give us a simple step-by-step plan.
Step 1. Schedule a comprehensive checkup, even if nothing hurts. Step 2. Get a professional cleaning and full evaluation, including necessary x-rays. Step 3. Ask questions about your personal risk factors, grinding, gum sensitivity, diet habits. Step 4. Follow a customized home care routine, proper brushing twice daily, flossing, and recommended products. And finally, commit to regular follow-ups every 6 months or as advised.
So it is not complicated, it is consistent.
Exactly, Rasim. Small, steady steps create long-term protection and peace of mind.
Before we wrap up, Dr. Esma, let us talk do and do not, because people love shortcuts. What are the biggest mistakes you see patients make before or after a dental visit?
Great question, Rasim. Do not brush aggressively thinking harder is better. That can damage enamel and gums. Do not ignore minor bleeding or sensitivity. Those are early signals. And please, do not rely only on mouthwash as a substitute for flossing. On the positive side, do keep a consistent routine. Do share your full medical history with your dentist and do ask about anything that feels unclear.
So the key is awareness, not overreaction.
Exactly, Mr. Rasim. Smart habits beat quick fixes every single time.